thank you everyone for being here. Like I have said in the beginning, this is just evolving by the hour. We were getting briefed before we came down here, and it's probably going to change again. But I want to say a few things before I get into the numbers and everything else. Look, to the media, to business owners, to everyone, you should have a contingency plan in place. It's here. It's only going to continue to go up. If you see what's happening in Italy and Germany and everywhere else, it's going to continue to grow here in this country. And I know some people still don't believe it. I know some people think it's not going to happen. But I'll get into all that in a minute. You'll notice my deputy will no longer be with me and my counsel. They're at separate locations, and I have office already cut in half working at the OC in Clarksville. Because once you get contaminated, you're out of the game for a while. Government has to run. Companies have to run. EMS, fire, hospitals, jails, they still have to run. So there has to be a plan of action where if the people in this room are affected, then you have a second layer and a third layer and even a fourth layer if you can do it. I highly recommend everyone heed to that, get ready for it, and get ready to operate with less people and people getting infected and not being able to have contact. As of today, our numbers are up to 15. 15 confirmed positive cases of COVID-19. One person remains in the hospital. We have, and this number keeps changing, and Liza and I were going back and forth. This number keeps changing. 90 people are under mandatory quarantine. 367 people are under precaution quarantine. That number was high as 500 the other day, and that number is going to fluctuate. Some of the things I will say this to the media, we're aggressively testing now. I want to commend the governor on that. The more tests we're putting out there, you're going to see more cases like this. But we're not talking about is the instance of the people that don't have it. So there's a lot more people coming back negative than positive, which are good, and we should kind of concentrate on that a little bit. But I want to explain to the media, and I had this conversation with Sheriff Apple yesterday, there's two definitions, voluntary and mandatory. Voluntary, we can't keep you home, but when you're mandatory, we can. And I'll give you a scenario, not to make anyone panic, but yesterday, this individual decided to have open house, and they're mandatory. And we're like, you can't have people in your house. What are you doing? Oh, my husband cleaned it, sanitized it, and I'm gonna stay outside. Doesn't work that way. When you're mandatory, you can't, we have rights to do different steps. I commend Dr. Whalen and her staff. They handled it great. We still had the sheriff respond just to make sure that they understood the difference between mandatory and voluntary. We're going to run into issues like this. People, for some reason, it hasn't soaked in the new norm, and I'm going to try to help you get there. I know the governor, and I commend him. He just put it out. We were going to have restaurants go to delivery, curbside only. And that goes for Cross Gates in Colony Center. We've been monitoring the social distance is 6 feet. If that's not being abided by, we're going to probably look it down, close down everything. That's where we're at. I want to be proactive. I'm not trying to scare anyone. We're just trying to say, listen, it's here. It's been here. We need to stay calm, but you need to be prepared. And you need to be ready and take this serious, because the more serious precautions that we take, the less infected people will get and the spread will stop. But we can't do that if people are still going out and congregating at restaurants and bars or going out. You know, we want you to go out, but keep your 6 feet distance. Don't congregate. So I'm glad the governor just put out that stuff. That's what the doctor and I were just talking about, them protocols. Which is great. Our medical reserve corps could use your help. I'm realigning things as under our emergency order. I'm going to be working with the different towns, cities, and villages, and mayors and supervisors. I've been on the phone constantly with Kathy Sheen's office and talking to Kathy. We're helping each other out, and I'm going to be putting a call out to the superintendents today about their RNs and their people that are home now from the schools for a while to come help out and work with us. We need medical trained people. And we need people that want to just answer phones and help out with this. And like I said, under the governor's, one of the governor's rules, we have to go out and visit these people who are in voluntary and involuntary confinement once a day. So at one point, when we were up to over 600 people, just do the math, that's 600 visits every day. It's draining from the resources, and we want Dr. Whalen and her staff to continue to do the great work they're doing and continue to go that way. Our Department of Social Services will continue to serve individuals, mostly by phone. We got approval from the state, so everything we're going to do for new applicants, people that need assistance, we still got to operate. But we're going to do it via phone and computer now. There's not going to be any reason for people to have to come in and do face-to-face contact. The guidelines will be up. We'll be talking about that. For new applicants or individuals receiving benefits, can fax, mail, or email their complete application or document, but everyone must have an active phone number on their paperwork they submit, because we're not going to be able to get a hold of you if you're not, or a number we can get you. The guidelines, like I said, will be on our, shortly will be on our media outlets. We'll be putting that out. And again, to slow this virus, we're going to that contingency plan. And I advise everyone here in this county to do it. Look, our numbers are definitely going up, but it is because of the aggressive testing from the governor's office and the work that we're doing, but it's the norm for around the state of New York. It's continuing. Every county is going to be hit one way or another with the same stuff. As we look at the restaurants for the next 14 days, to slow this down, I know it's gonna, people are going to talk about the economic impact, not only on the small businesses, but on the economy as a whole. I can assure you, first and foremost, residents' health and safety are the first priorities, not how much money we're losing, not how it's going to affect our economy going forward. We'll bounce back. We're Americans. We're great at that. We'll get through this. And again, it's going to get high before it gets low, and then we'll hit that high peak, and then we're going to be on the slope down, and we'll bounce back. We always do. So at this point in time, I'm going to turn it over to Dr. Whalen to discuss some of the stuff that's going on in the Department of Health right now.
Thank you, County Executive McCoy. We had a busy weekend at the Health Department as we continue to identify cases and conduct tracings to identify contacts. At this point, we have 15 confirmed cases. These cases range in age from 13 to 74. They are people from around the Capital District. Many of them are home recovering from illness. One is hospitalized. Of the patients that we've identified, 2 of them were travelers. One was from Italy, and the other was from Ireland. The others appear to be community acquired. And this is an incredibly important message, because this really hammers home the importance of utilizing community mitigation strategies. The county executive referred to the 2 conditions of quarantine, mandatory and voluntary. Mandatory, we have issued legal orders to individuals. We are following all of our voluntary quarantines as well. And I will say that if we find that someone under voluntary quarantine is not adhering to their quarantine requirements, we can make that a mandatory quarantine, can and will. It is essential, particularly for parents, to realize that their children, if they have been identified as a contact, need to be adherent to the guidelines that the health department is suggesting. They need to be in their own room with their own bathroom, and they need to be contained for a period of 2 weeks. We know that children can have a very mild form of illness, but they also can put people that are significantly at risk in serious danger. I can't underscore enough the importance that all of us play in what happens over the next 2 weeks. We are estimated to be 9 to 10 days behind Italy. Please look at what's going on there. What we do right now as a community in terms of limiting social interactions can blunt the curve and help what's our hospital capacity and our capacity to care for those that are ill. It is time for the community to take this seriously, not only individuals that have been placed under quarantine, but each and every one of us is encouraged, strongly encouraged, to know how to prevent yourself from getting this illness. Knowing, again, how to use appropriate hand sanitizer, how to wash your hands, how to avoid gatherings of, I believe the guidance today is more than 50 people, but I would be looking at smaller numbers than that. It is the time to cancel parties, birthday parties, get-togethers. A lot of kids are on spring break and they want to congregate together. It is, as parents, you should be discouraging them from having sleepovers and parties. This strategy is really all we have right now to protect us moving forward with this rapidly evolving course of events. We know from the cases that we have that this virus is in our community. We know through the aggressive testing that we're doing that we're identifying more cases. We still don't have an exact handle on how many cases we have in the community, and we expect that as the testing continues, we will be seeing increasing numbers over the coming days. So I think at this point it's essential that everyone in the community participate in this response. Whether you consider yourself affected or not, please participate in this response.
Dr. Whalen brings up some excellent points, and that was, just driving home, when I go home or you're going through a neighborhood, you're seeing kids out congregating together. The idea of shutting schools down, people, was to keep kids away from each other to stop the spread. Please, parents, I know, it's going to be tough. It's going to be tough keeping your kids away from other kids and keeping them preoccupied, but please try to do that the best you can. Again, I can't emphasize enough, we're into a contingency plan here in the county. We still have to operate. Regardless if everything gets shut down, county government, city, towns, and villages still have to operate. Keep in mind for your EMS, for your fire, for your police agencies that respond, if you are, they have the list. They have a list of updates of who's quarantined, who might be quarantined or who might be under mandatory quarantine. But if you feel you're exposed, just let the 911 dispatchers know that before the agency gets there. They're responding so they can respond effectively. But most importantly, before we take questions, I can't emphasize this enough. People need to take a step back, take a deep breath, relax. We're going to get through this. Go for a nice walk, clear your head. But you can't be bogging down the 911 systems or our health department calling for because you read something online or you heard a rumor. We will put it out. I said this before. We set up in the beginning with United Way the number 211. They can call there and you can bog them down all you want. It hinders Dr. Whalen, her staff, and my staff from doing our job when people are calling because they read something online. Someone put something on Facebook. I can assure you, we're not going to drag you down here just to hear us talk. We're going to give you live updates, and as things change in the community, I'm going to let the people know. But again, listen, we're all adults. Take a deep breath. We're going to get through this. We get through everything else. I'm going to plead one last time to the media, to the people watching this and listening. Please go to albanycounty.com/health and click on the Medical Reserve Corps to register if you want to help out. We can use you for anything, and trust me, we can keep you distance from everybody, and everyone's help will go a long way.